for humanity.
The time is just gone, 9:33 a.m. We continue with the show this morning, and we've heard a few days ago President Cyril Ramaphosa announcing the lifting of certain restrictions, and also at the same time, there are experts who are warning of a fifth wave in April and May. They're talking about the Deltacron. And we're joined on the line this morning by the chairperson of the South African Medical Association. We're talking with Dr. Angelique Coetzee. Dr. Coetzee, good morning to you and welcome to the show.
Good morning and a good morning to everyone. Luckily, I'm now the past chairperson, but I'm still part of SAMA.
All right, perfect. Well, Dr. Coetzee, let's talk about this announcement. Yes. That President Cyril Ramaphosa has talked about lifting some restrictions. Now, I'm sure that was expected, considering what we have been experiencing in the last few months with regards to the COVID-19 pandemic.
Yeah, we expected that restrictions would further be loosened. Actually, we should not be in state of disaster management anymore, and the regulations that's out there should be amended, or the Department of Health to give the minister some power to to be able to have the jurisdiction over masks, social distancing, what we call that non-pharmaceutical interventions. So while we are happy that the mask wearing is not compulsory outdoors anymore, which is fine because there's good ventilation, it's natural ventilation, so that should not be a problem. So we're happy with that. However, it's still a problem to say to people, especially indoors. They work. The regulations is quite clear that 1,000 people indoors, but you have to wear your mask and you need to make sure that you bring proof of vaccination, which is right. It should be like that. But in South Africa, we have learned who's going to enforce it. The church is going to enforce it. Is the sports stadiums going to enforce it? For outdoors, 2,000 people, if you, or 50%, if you can prove again if you are being vaccinated. So it's very nice on paper, but practically it's going to be a huge problem. And then we have this in the back of our minds, this nagging fear that if you look at the variants behavior the past 2 years, that we most probably, based on that pattern, can be going into our fifth wave around about to May, end of May, middle of May, June. And I think, if you then want to fall back onto stricter regulations, it's going to be extremely difficult. Especially around
this is something that has been a cause for concern where we are at this point in time as far as restrictions are concerned and regulations surrounding managing this pandemic. But in terms of, going the other way, and as you mentioned, stricter regulations. But I just want to qualify one or two issues here. Okay, we're talking about mask wearing outdoors, which is one issue. But there have been certain reports, and I think we need to just be cautious, and we need to understand carefully what is meant by mask wearing outdoors and gatherings for social events. Because I think this is extremely important for people to understand and adhere to, Dr. Coetzee.
Yes, you are absolutely correct. So for the next 6 months, it would be crucial for us to not abandon all the non-pharmaceutical interventions just because we all had enough of mask wearing and people are had enough of COVID. We're not out of the woods yet. We still have more than 1,000 people on a daily basis getting infected, or being reported to be infected. And we're not talking about the ones that's not been tested. So if there's 1,000 plus that's been tested positive, you can actually multiply that by 2, and that is still what's going out there in the public. So if you then just abandon all precautionary measurements It's going to cost us in 2 to 3 months from now on if there's going to be a fifth wave. If, however, you make sure that you are vaccinated, and vaccinated, follow up with your booster as necessary, because what we have seen in this practically experience, if you have been vaccinated, had Delta before, been vaccinated with Delta before, or any of the other variants, up until September last year, we see that they are then, a lot of people get what we call immune escape, and they then got the Omicron. So for now, it seems to us that your immune system lasts about 6 months, or been protected for about 6 months by these variants that escape the immune system. So if you had your jab, your booster in February this year, and you come into the surgery with an upper respiratory tract symptoms, I know that it's most likely not Omicron, because we know for at least 6 months you will be protected. So, if it's not going to be strict adherence to those protocols, of if you're not vaccinated or vaccinated and never went for your booster, you should be careful by not wearing your mask and going into where there's a crowd of people, because you can still get whatever the new variant might be coming in future, or still Omicron if you haven't had Omicron as yet.
Yes. Now, also, Dr. Coetzee, this Deltacron that is being talked about, and we've learned that this is a mixture of Omicron and the Delta variants. We've also seen reports about the spread of this variant, mostly in countries like France, in Denmark, Germany, Holland, the United States, and in certain parts of Asia. And what some of the experts are saying, that South Africa will see this Deltacron, or this fifth wave of infections, around the end of April and May. But at the same time, we are also heading into the flu season. We know there's going to be changes of season, so there are chances that many people will catch the flu. And what is important is to try and identify whether a person would be having this variant, or is it just the simple flu that we've come to know over the years?
You're absolutely correct. Remember, you can have flu and you can have Omicron simultaneously. There's no rule that says you can only have one. You can have both of them. That's what we saw with Omicron in the beginning with the hospital stats. Remember, everyone was saying, yes, we admitted a lot of children with Omicron, and then we keep on saying, but those children didn't have Omicron, or they were not really sick. And then later on, it was said that it was incidentally they had what we called, most of these respiratory tract infections, especially in the children, is Haemophilus influenza. And we saw that a lot of them had been admitted for Haemophilus influenza and then incidentally tested positive for Omicron. So you can have all of these variants. So you can have flu and the variant, but it depends on which variant will be on the horizon come April, May, June, and we do not know. So Deltacron would be difficult, because if you had Omicron, whether you know it or aware of it or not, so, like symptoms, you thought it was only a little bit of a cold that you had, you will have immune system, but we see it lasts for about 6 months. So, we don't know. There's no one in the world that can tell us what's going to happen within the next 6 months from that, And if in the next 6 months we don't see another variant, and we only see flu and the normal seasonal infections, we're very happy, and we can then say, okay, maybe we are over the worst part of the pandemic.
Mm. And also, I think just one issue on hospitalization and preparedness for hospitalization, because when one tracks from the time the pandemic had hit, and then looking at all the variants, we know when it was the Delta wave, there was a mass hospitalization, and hospitals were under severe pressure, and not so much when it came to the Omicron variant. And just looking at this latest variant that we are talking about in terms of hospitalization, and some experts are actually saying that because we've reached herd immunity, people have vaccinated, some are leading healthier lifestyles. We may not have a pressure situation as far as hospitals are concerned in dealing with this fifth wave, or should we be hit with this latest variant?
We don't know. For now, what we can say is that it seems that the vaccines protect you against severe disease, doesn't protect you against mild disease. So it all depends. Again, you can have as lot of herd immunity, as possible, but if the variant escape your immune system, then herd immunity is also not going to assist a lot. So therefore, we will be able to answer these questions, which is extremely important that you are asking. But we would be able to answer these questions once if we are in the fifth wave with a new variant. If it's again Omicron, spike of Omicron, we're not worried. Hospitals should not be a problem. People should be fine. They should have mild disease mostly. Death rate should be low. If we have, however, something like Delta, similar to Delta, we're going to be in trouble again because I don't think the hospitals are really that much prepared for a huge influx of people.
Yes, and just finally, just your thoughts on vaccinations, because I'm not too sure whether we've reached or this country has achieved its target as far as vaccinations are concerned, and at the same time, just looking at further booster shots, because some are saying we may need them, others are saying we may not need the fourth or even fifth booster shots that have been proposed by vaccine manufacturers, Dr. Coetzee.
So again, very good question. If you look at the vaccination rate in South Africa, I don't think we're doing that well. Around about 45, 46% of people had one dosage at least. Not so many people had all their dosages or even the booster dosages. So we know that one dosage will not protect you again against mild disease, and it depends again what your variant will be, and how good it escapes the immune system, or how good your immune system, being vaccinated, can defend yourself. We don't know that question. So, if you want to get rid of masks and you want to get people back into sports stadiums and churches, then it is important to get your booster shot. Because remember what I've said: if your last shot was more than 6 months ago, around about September last year, you're not protected. We see them in the surgery. We see them getting Omicron. Yes, it's mild disease, but we do not know what the next variant will be. And if you look at that, then I think it's important just to get your booster shot. Then at least, in South Africa, we're only at first booster shot. And let's see and ride the wave and see what's going to happen going forward. But it is important.
Well, Dr. Coetzee, thank you very much for that. Former chairperson of the South African Medical Association, Dr. Angelique Coetzee, we thank you. We appreciate your time with us this morning. All the best to you.
Thank you so much, and please stay safe.
That was Dr. Angelique Coetzee. The time is just gone, 9:46 a.m. We come back and we're talking about an event that is taking place in Cape Town this week. We're talking about Jamiatul Qurra. They are inviting you to their Ramadan warehouse market.